Hi, Mike Gibson with my good friend and colleague, Dominick Angiolillo. Dominic, I went to the University of Chicago, and one of the phrases there was when you get in an argument is define your terms. Yeah, we hear a lot of terminology thrown around about thienopyridines, escalation, de-escalation, but you have led the Academic Research Consortium in really defining all the terms that we use surrounding DAPT and its use. Talk to us a little bit about what you and others have published.
Well, thanks, Mike. Thanks for having me. Over the past years, as you mentioned, we have learned that there are different ways of implementing antiplatelet therapy in our particular patients undergoing PCI, where we can either uh, intensify the degree of platelet inhibition or reduce the intensity of platelet inhibition. And so, as the field has evolved, and we become more creative because as interventionists we're very creative with the drugs that we have. There have been a number of modalities. The problem has been that with the ever-growing number of modalities to escalate, but in particular to de-escalate, because that's been a central theme in the past several years, uh, we start using a number of terminologies, and some of them tend to overlap. And so there's been a lot of confusion. And what we decided to do is call a timeout and say, why don't we get together and come up with a consensus on the terminology so we're all speaking the same language. This was the scope of the manuscript.
Yeah, and so go through some of the common terms and how we've defined them.
Absolutely. So the, the first comment I want to make is that the manuscript was intended to provide definitions only. We're not telling physicians what to do. Now, there may be a follow-up to this, but we want to keep things simple because the goal of these definitions is not for to be used for experts like ourselves, Mike, but for everyone. So it's based on three core concepts, whether you intensify or you increase or you reduce the intensive platelet inhibition. So you can achieve this either by switching a drug, by modifying the dose of a drug, or discontinuing a drug. Okay, very, very simple. So let's take, for example, de-escalation, right? We can switch a drug, so we can go from prasugrel, ticagrelor to clopidogrel. That's a de-escalation by switch. We can reduce the dose of a drug, done a lot, for example, in Asian countries, for example, going from prasugrel 10 to 5, or we can discontinue a drug. Now, this is interesting because traditionally discontinuation was stopping the P2Y12 inhibitor and maintaining aspirin monotherapy. But now we have discontinuation also by stopping aspirin and continue with P2Y12 inhibitor monotherapy. So they're both concepts of discontinuation leading to short DAPT. But we have to create a framework, which is what we did in this document. We can make the same exact argument for escalation. So we can switch and escalate, go, for example, clopidogrel to prasugrel ticagrelor, and we do that in clinical practice. For example, you have a patient with an ACS or stent thrombosis on clopidogrel, you may escalate to one of the more potent drugs. You can increase the dose, or you can add on, right? Even there's the concept of add-on. You can add on to aspirin, a P2Y12 inhibitor, but you can also add on a P2Y12 inhibitor to aspirin. So it's a concept of intensity. That's the key concept of modulation. So we create this framework. Again, we try to keep it as simple as possible, where we provide some of these examples that I just uh, uh, described over the past few minutes.
Well, we've had a bit of a Tower of Babel. I like to say if you can't define it, you can't measure it. If you can't measure it, you can't study it. So, I think this will also help us a lot in all of our research efforts to make sure we're all on the same page and quantitating all these changes more accurately. Dominic, thanks for joining us today. Congratulations on yet again another great paper in this field. Thanks to all of you for joining us here with this Snackable Health episode.